Good morning, citizens, colleagues, and government officials of Little Rock. Thank you for inviting me to speak here at today's town hall meeting here in Little Rock, Arkansas. My name is Janae Brown, and I'm a public health educator with the Arkansas Minority Health Commission, and I am here today to talk to you about food deserts in Arkansas. This presentation will speak on the current disadvantages of many communities, especially rural communities within the Delta and eastern Arkansas, but not limited to poverty-stricken areas within the central Arkansas areas. When it comes to food deserts, I will be educating on what a food desert is, how it affects overall environmentally, and how it's a public health concern. Some of the articles I will be using to help me present today will include the Arkansas Hunger Relief Alliance. This is a general information article that gives you background information on food deserts and various organizations that can help. I will be using the Arkansas Center for Health Improvement 2017 January edition that speaks on what food deserts are and where are they located in the natural state. I will use an article from the Sage Journal on Food Deserts from the Volume 4, Issue 2, 2010 edition that speaks on environmental and public health issues within deserts. These will include the different health disparities and inequities that will exist because of the food deserts. And last, the Arkansas Coalition for Obesity Prevention. This will give general information on the impact deserts have on obesity and the organizations that are around that can help. So what are food deserts? According to the Center for Disease Control, a food desert is an area that lacks access to affordable food. Food deserts are areas that lack access to affordable fruits, vegetables, whole grains, low-fat milk, and other foods that make up a full range of a healthy diet. Due to the lack of healthier food items, individuals can see a negative effect towards their overall health. There will be an increase in chronic diseases such as heart disease, cancer, and diabetes. This is caused by an increase of overall overweight that leads to obesity. The Arkansas Hunger Alliance states that approximately 2.3 million people live in food deserts currently. According to that same article, food deserts are a major inconvenience and cost to urban and rural areas within them. It increased distance in food trips or constant quick mart visits that tend not to hold much nutritional value at all. For better understanding, I will speak briefly on a town located in a food desert here in Arkansas. According to the Arkansas Hunger Relief Alliance article posted on 2014 by Darius Toney entitled Food Desert, Eastern Arkansas have many food deserts. Hughes, Arkansas, however, did not particularly have any effect until 2012 against these. Hughes has a population of approximately 1,400 people. In this town, there was one fully serviced grocery store and two overpriced corner markets. The major grocery store was Locke's Grocery Store. Not only did it provide food for the locals, but many surrounding small towns as well. And in 2012, its services were halted due to fire and smoke damage. When a feasibility study was performed due to the town's size, economic status, and decrease in population, the mayor is currently unable to provide the town with another store. It would cost more than the area could actually be able to put back into it. These are things that are happening within the central Arkansas area as well. Many small stores, grocery stores such as Harvest Foods, are either being taken over by other stores or being completely shut down in little outskirts cities like Mableville and Shannon Hills that are right there on the border of Little Rock. Location, location, location is key. So where are food deserts prominent in Arkansas? According to the Arkansas Center for Health Improvement, the January 2017 fact sheet on food deserts, all counties in Arkansas have food deserts, including areas like Pulaski, the Jonesboro area, Fayetteville, and other large metropolitan areas inconsiderable for our state. However, at large, most of these areas that have food deserts and are affected the most are within the Delta and Eastern Arkansas. This is a result from a drastic decrease in supermarkets on a state level from 853 to 495 between 1997 and 2013. 65% of Arkansas counties have 5 or less grocery stores within their county's borders. However, they do have smaller locations such as Quick Marts and convenience stores that sell quick prepared food and snack items. However, these are very unhealthy and lack proper nutrition that an individual would need, especially children. In areas of poverty such as Pulaski County, we are faced with smaller communities within our areas such as the 12th Street area, the Wrightsville area. You have areas within Southwest Little Rock that don't have a lot of freestanding grocery stores. They might have a local Walmart. However, within the areas where most of the people live, they have plenty of fast food, gas stations, and dollar stores that sell something quick that can be prepared quickly versus going to the other side of town just to use your benefits, which most people have SNAP, to receive any food. So the environmental impact. Environmentally, health deserts end up negatively affecting the environment. Health deserts create a depletion of resources within an area. This includes via crop productions in local farmer markets. They are often the last strain of resources a community has, especially in many rural towns. The increase of crop consumption causes a decrease in what's available to the community via a small local farmer. Overworking the land also causes bad crop turnover, which increases the depletion of the soil. The depletion of the soil can also increase to erosion, and it can also increase the water supply being contaminated. According to the Sage Journal entry on food deserts, Volume 4, Issue 2 from 2010, many of these areas have large amounts of quick convenience-based stores that can negatively impact the environment via pollution from waste created by an decreasing of traffic within areas, plastic wrappers for quick deli snacks that are thrown and forgotten about on the ground, and improper disposal of grease that could be used for food preparation. It also speaks on neighborhood construction, which is key in food deserts. We see this a lot in poverty-stricken areas, which many people live in. Most neighborhoods in food deserts are built with various fast food places and other unhealthy eateries as their main source of food in these lower incomes and rural areas, while their actual markets resides in a more economically driven area that many people cannot access. These lower income areas are faced with typically overcrowding, competition for decent resources with little means. These areas are also faced with higher air pollution rates due to the increase of travel needed to receive adequate food or constant trips to the local neighborhood convenience store. So, public health concerns. Before we can go over public health concerns, one must understand the difference between a health disparity and a health inequity. Health disparities, according to the CDC, is a difference in health that is closely linked with social or economical disadvantages. These include things like breast cancer survival rates among African American women. Although African American women tend to get a more deadly form of breast cancer, they are also suspected to less resources that Caucasian women would receive, and less adequate health care that they would receive as well. Rates of obesity in the Hispanic communities is also something that would be considered disparity. And health inequity is a difference or a disparity in health outcomes that is completely avoidable. For example, you have premature death due to non-communicable diseases, and poverty causing tuberculosis. Tuberculosis is something that can be prevented. It is something that many people can easily get treatment for. However, without proper resources and money, many people, and especially underdeveloped countries, cannot receive these medical treatments due to their lack of financial support. So, public health concerns. Some of these concerns include health disparities such as the increased rate of chronic diseases, including cardiovascular, diabetes, and hypertension. This is the result to an unbalanced and unhealthy diet rich in carbohydrates and sodium due to the lack of proper accessibility and availability of food. This also results in obesity, especially in children and their constantly changing bodies. The population affected most are minorities, women, and children due to their tendency to live in poverty-stricken areas, which also tend to be food deserts. Some inequities include rates of diseases increasing due to the lack of economical infrastructure to create areas of accessible healthier foods. It also includes the increase of children obesity due to the lack of proper food availability. Many people in food deserts, although poverty-stricken, cannot even receive government assistance like SNAP to actually be able to purchase healthier foods as it was intended to be. This is because they do not have all the necessary materials and education and knowledge to go out and apply properly for these benefits. So what are we doing? Partnerships with the Arkansas Coalition for Obesity Prevention, UMS, Blue Cross and Blue Shield, has been able to create Growing Healthy Communities. Growing Healthy Communities is a project by the ACFOP that allows grants to be awarded to help battle obesity by allowing more access to healthy foods. It raises awareness, allows healthy cooking classes to be hosted, pushes lessons on being healthy to young children to help decrease the disparities against them as well. Some of these grants that were utilized here in Little Rock includes the Little Rock's 36th Street Community Grant that was about a $900 grant that was awarded to help create community gardens within the 36th Street community. That is known to be the John Barrow area. Also, with the Little Rock South Main Street community, that was awarded $1,200. This was to implement a farmer's market and various different SNAP benefits programs that allow people with SNAP to actually go to these farmer markets and use their benefits there. Another organization that actually helps with this problem of food desert is Fresh to You. Fresh to You is a mobile traveling farmers market that accepts SNAP. It goes around the Pulaski County area currently to help feed different communities. And you have Feed Communities. Feed Communities is a church-based organization that teaches programs to incorporate healthy living, eating, and cooking around a natural state. It is using basically the expanding of local food systems for food security. Different programs include Farm to a Preschool, Community Gardens, and Plant a Row. Conclusion. Food deserts affect our entire state here in Arkansas. Although food deserts are mainly in rural areas, we are locally affected in the metro as well. Negatively, it affects our environment and our overall health, and it will continue to increase these chronic diseases unless we can do something about it. Currently, we have some great government-funded programs in place, but we do need more. And education is key to everyone to help eliminate these food deserts. I thank you for your time today, and I will be by for any further questions.